We are doing
got video.
so.
That should be going up since there's motion, but it's going nowhere near the 90. Then you can do
Okay.
get over here?
So now,
It's weird. Why is this like that?
Welcome to the Graduate School of Social Work at the University of Denver. I'm Amanda Moore McBride, and I have the honor of serving as Dean of this fine institution. I'm so grateful that you all have chosen to spend part of your day with us today to address one of society's most entrenched social issues. I love that there's faculty, there's staff, we have master's students, doctoral students, we have alum, and we have so many community practitioners in the room. I do have to note for those of you that are in the room, we understand there's still lots of people coming from across campus, so they'll be filling in around the back, and we'll bring in more chairs if necessary. I also have to call out via live stream, we've got several hundred people joining us from across Colorado and across the United States. It's tremendous that so many people see this as an issue, not only of tremendous concern, but it's a human problem that was created by humans, and that means the solution rests with us as well. The American Academy of Social Work and Social Welfare identified several years ago 12 grand challenges facing the human condition, and they charged schools of social work with attempting to orient their training and curricula around training the next generation of social workers to deal with those issues. They also said schools of social work, your community engagement should be directed, and the research that your faculty are doing should be directed into those communities in a way that we can actually work towards solving these issues. And for us here at the Graduate School of Social Work, we've translated this charge into our Science for Action series. I love that moniker, Science for Action. And I love it because it embodies our faculty and their commitment to social change. Our faculty don't want their research just to rest on a cloud somewhere. Used to rest in libraries, but now it's on clouds. They actually want it to translate into policy and practice. So in many ways, this series represents the spirit of our faculty and the kind of change they want to see in the world. How we've structured this series is that we're addressing each of the 12 challenges, 3 each year. So this year, and I see some familiar faces that were here at our other events. The first one focused on prevention, and specifically prevention as it relates to behavioral health. The second one focused on decarceration. And of course today, we're addressing homelessness. There'll be a save the date coming out for next year. We're already working on the 3 for next year. We'll start with poverty, move to health and wellness, and then to healthy and productive aging. So join with us across these issues that impact so many of us. I want to turn the program over to our chair, Professor Danny Brisson, embodies everything I just said about Science for Action. In his dedication to social justice, he was everything from a Jesuit volunteer corps member in Belize to leading community development programs to now focusing his research on housing and homelessness and leading our Burn Center for Poverty and Homelessness. So he has helped to conceive this day, pull all the people together. And what I hope all of you are able to take from this is new relationships, new connections, that you learn things you didn't know, that you actually challenge and interrogate one another today, because we're still touching all parts of the elephant. We don't have this figured out yet, and it's going to take all of us working together to generate the solutions necessary. So thank you all so much for being here. Let's get the day started, Dave.
Well, thank you. Thank you all for being here. Is this working? Thank you all for being here. I'm Daniel Brisson. I am an associate professor here at the Graduate School of Social Work, and for about 12 months, I have been the executive director of the Burn Center for Poverty and Homelessness, which is located here at the Graduate School of Social Work. Actually, our offices are right down the hall from you now. There are many of you in the room that I don't know. And I'm really glad you're here, and I really look forward to getting to know you. The Burn Center on Poverty and Homelessness is working really hard to increase our impact and our visibility locally in the metro area and around the state. So as Amanda said, we hope you get some important lessons from today. But as you know, coming and talking about the issue isn't exactly how we change lives for people experiencing homelessness. So we've structured the day such that first you will be hearing from some great national and local speakers about what we know about the issue of homelessness. And you'll get a chance to ask questions of them, hopefully learn something, hopefully some real active listening there. I look forward to hearing them. And then we're going to have a break for lunch and have a great speaker, Don Burns, the founder of the Burns Center on Poverty and Homelessness, is going to speak to us. But then in the afternoon, I know you're taking time out of your day to do this, and some of you will only be able to stay till 10 or 11, but hopefully you can stay till the afternoon, because one of the things we really want to happen today is we want to hear from you. We're going to break into groups where you can interact with each other, and you can give all of us feedback. And together, not the panel speakers or myself, but together, we can talk about these issues. And as Amanda said, hopefully, at the end of the day, we've built some connections, some relationships. There's some work being done, or some work laid out in front of us, so that we can really address this issue of homelessness. The point-in-time count came out recently, and many of you know what it says, right? I don't need to tell many of you about the prevalence of this issue. The point-in-time count says that there are over 5,000 individuals experiencing homelessness in the metro Denver area, and there are over 11,000 individuals experiencing homelessness in the state. What we also know is those basic prevalence statistics, right? What we basically know about homelessness isn't accurate enough, isn't fully capturing the nature of this issue, right? So today, we have social scientists like myself, like Ben Henwood, who are thinking through the questions that we need to address and know effective interventions to address and end homelessness. Also in the audience, we have practitioners, people working with people experiencing homelessness, coming in the doors of their office every day. And those people in the audience, those of you here, know that you don't have the right answers, and the social scientists aren't asking exactly the right questions for what you need on the ground. We also have people with lived experience of homelessness with us, or many of you probably are close to the issue of homelessness because of some personal experience. And another thing we know is that our policies to address this issue need to be better informed by both the science, the evidence, as well as the voices of people who know what this experience feels like. And so we have policymakers in the audience too, who are hungry to hear the ideas we have. So with that, I thank you all for coming. I hope you deeply engage. I hope you communicate with me. You'll see me again throughout the day, but you communicate with me about what you heard and what can happen. And I look forward to a great day with you. Next, I'd like to invite Hope Wisniewski to the stage. Hope is our Chief of Staff and Associate Dean of Operations. I know Hope well, I just don't know exactly her title. We're happy to have her here this morning.
It's great to be here this morning. I'm really happy about the opportunity to speak to you all today. And I have a couple of things that I want to talk about. First of all, the fact to me that we have Coloradans living with lack of access to affordable housing is not a partisan issue. So while we know that working across the aisle in this moment, and while we know that asking our politicians to work across the aisle is incredibly challenging, we know that that must be done. We also know that showing up to the lobby as a constituent, or making a phone call, or testifying, or Even engaging in a courageous conversation with our neighbors is also challenging, but we know that that too must be done. So thank you so much for being here today to learn about the complexity of the challenges of homelessness and to think about what you all can do as individuals and also what your organizations might be able to do to help respond to this issue of homelessness in our community. U.S. Senator Michael Bennet has been an advocate for issues related to homelessness here in Colorado. He has successfully secured federal funding for our most vulnerable community members, and his staff here in Colorado listen. They answer the phones, they respond to our emails, and because of that, they're able to translate to our politicians in DC the urgency of issues that we believe in the most, including homelessness. I've had the opportunity to work with Senator Bennett's office for many years, and I've also showed up to lobby, to make phone calls, to speak to Senator Bennett, to talk to his staff. And I've appreciated that opportunity to share about issues that I care about most as a Coloradan, including people access. So it said that listening is the first step to understanding. And understanding homelessness is broad, it's complex, and it affects so many people here at home in Colorado. So first, we must listen. Senator Bennett's Colorado Community Liaison, Lily Griego, is here with us today. And I always feel really lucky when I have the opportunity to connect with Lily and to talk with her about issues we're facing at home in Colorado because she always answers the call, she always responds to her email, always, and she makes sure that she stays present and that she listens. So she and her team live and work in our Colorado community, and they serve as that touchstone for Senator Bennett. She and her team ensure that the issues that we care about are translated back to DC. So thank you, Lily, for being here with us today as we join together to learn what it's going to take to end homelessness, one of our grandest challenges.
Good morning, everyone. Morning. Oh, well done. I wasn't sure if you were first of all, thank you to our hosts for hosting this event. I was listening to the introductions, and I think the idea that someone is willing to open up their doors to invite folks in and have this conversation is the first step, and it's a well-done step. This audience is amazing. You look amazing. You look beautiful. You're a representative of different generations, of different age groups, of different every color under the sun, which also is my favorite thing when I see different people in the room. I think that your hosts have done a proactive approach to making sure that your leadership today is going to be reflective of conversations. And that's one of the points I wanted to make today, is that I did hear that there are some policymakers in the room, but by being here today, every single person in this room has just demonstrated that you are a leader on this issue. So I'd like to have you give yourselves a round of applause for being a leader on this issue. One of the things that and thank you, Hope, for the great introduction. When Hope gave me a quick call, I wanted to share with you that we actually do answer all the phone calls. No one in our office is above or below answering a phone call. We have interns that come in, many of whom are from DU, by the way, and they answer the phone calls and they listen to folks' concerns. And I don't know if anyone in here lives in the city of Lakewood, Colorado right now. The city of Lakewood is facing an issue on the Federal Center. So I have the privilege of working at the city of Lakewood. Talked about St. Anthony's Hospital, where I was born, where my son was born, moving into Lakewood out of Denver away from Sloan's Lake. So when that hospital moved in, the development community, that's the private sector, the government, the local government there was ecstatic, and the business community was ecstatic. Why? Because development usually means big dollars. It also means property values increase. A portion of that property is now being looked at for what is commonly being called a homelessness site. There are legislative factors that play here, and there are local voices at play here. Your business community, your local leaders are all engaged in this topic. Senator Bennett has been made well aware of the concerns of the community. Two things that come to mind when Hope called me. Number one, when I've answered the calls, personally speaking, in Senator Bennett's office, the fear and the anxiety that people have about homelessness and people who are homeless is something that shows that we're not engaged enough on the topic. we are not aware enough of what is creating homelessness and what homelessness looks like. And when I talked about the color, looking out at the color of all of you, if you've looked at homeless folks, they are every color under the sun, every size, shape, and gender. We've got gender as a huge concern for me when I advocate for women's equal justice issues. But when you look at children who are homeless and face the cruelty of homelessness, it is heart-wrenching. And so one of the things that I thought about coming here today was that I was ecstatic that you came here of your own will, and that you're showing a leadership position to dive into this conversation head on, face it, and then have action steps to show results to our community, because Colorado is desperate for you to do what you're about to do today. So I just want to say thank you. I personally thank you. I personally thank you for being part of your communities, not only the work you're going to do here today, but please go back and share it with your families at the dinner table, at your coworkers' quick coffee talks that you have, at your community conversations when you all meet for microbrews, which I hope you're doing, and share with people this is not something that we should be afraid to talk about. No challenging conversation should be something that we shy away from. We want to make sure that people understand what homelessness looks like and what the face of homelessness is for Colorado, and Lakewood is the best example right now. With that said, I do want to add that it's my honor to be here with you today. Senator Bennett is in D.C., and he sends his regrets that he could not join you. So instead, we sent a letter from Michael, and I'm going to put on my readers, which is new to me, and I will read that to you now. Honored guests of the Grand Challenge to End Homelessness, welcome to the beginning of a day of collaboration, thought-provoking discussion, and active engagement on a topic that has quickly outpaced our actions in Colorado to end homelessness. I would like to commend the students and faculty of the University of Denver Graduate School of Social Work for their proactive nature in bringing the homeless issue to the forefront of a solution-oriented discussion. Your activism is raising awareness to help people and families living in poverty. Last year, more than 500,000 people in the United States were living on the streets, and nearly 11,000 of them were here in Colorado. Remarkably, 20% of those who counted as homeless nationwide are children. There is not a single county in this country, by the way, there are 64 in case you didn't know that, there is not a single county in this country where someone working a full-time minimum wage job can afford to rent a 2-bedroom apartment. And I'm going to pause, and excuse me for doing this, I don't typically do this. I do want to talk about one thing I forgot to mention at the beginning, and that is that if you're not aware of this statistic, there are approximately 3,000 people moving to Colorado every single month, and the average house right now ballparks around 500,000. So if that doesn't give you an idea of how instantaneously somebody can find themselves in a situation where they're thinking about how they're going to make their next mortgage payment and where they're going to take their family, that should be some reality right there just in those numbers. And excuse me, I don't, like I said, usually interrupt Michael's letter. We won't tell him. Nobody will tell him, right? While the statistics, oh, how perfect. While the statistics and outlook may be grim, we can be optimistic about the work being done to address homelessness. Today, we thank each of you for being here to address such an important issue for our communities. I'm grateful for your timeless efforts to make a difference. Your dedication and hard work make our state a better place to live. Sincerely, Michael F. Bennett, United States Senator. Thank you again, everybody. Have a great day.
Well, good morning, everybody. I'm Jeff Jensen. I'm the Wynn Endowed Professor here at the School of Social Work, and helping to, along with Dean McBride, organize this Science for Action series, which she described so well a few moments ago. Before I introduce our keynote speaker, I'd like to thank Lily again for coming, and Senator Bennett for those inspirational comments and launching our day. So we're very excited that you're here. I'd like to introduce our keynote speaker, Ben Henwood. Ben is an associate professor in the School of Social Work at the University of Southern California. Ben's really an internationally recognized expert in this area of housing and also health services research. So he's someone we were very anxious to get to our school and speak here with you today and to interact with you actually this afternoon as well. So very exciting to have Ben here. His work is, I think, somewhat unique in that it really bridges both clinical interventions and what we could think of as more policy responses to homelessness. So this has been a particular watershed, I guess, a mark of the work that he's been doing. He's been funded in his research by the National Institutes of Health, National Institute of Mental Health, for example, National Institute on Drug Abuse, and National Institute on Aging. So he's had some very impressive projects in what's a pretty early stage of his career at this point. And really importantly, for the past 2 years, he has served as the methodological lead for an important project in the country known as the Greater Los Angeles Homeless Count, which is the largest unsheltered count of homeless persons in the United States. He's well published. He has a book you may be interested in called Housing First. Maybe some of you are familiar with that. I encourage you to look at that. And in the context of today's event, he is one of the co-leads, along with Deborah Paget of New York University, of the grand challenge called End Homelessness. So we're delighted to have Ben here. Would you please welcome Ben to the stage?
Okay, good morning, everyone. I'm going to set a timer here so I don't go over my limit. Thank you so much for the introduction and for having me here today. It's quite an honor. I have to say, on my drive in here, I was listening to the radio from the hotel, and I heard that there was a strike going on today. And then when I heard that there were teachers striking, I got a little bit concerned because I kind of imagined I'd look out and see a sea of young faces and thinking this talk is probably not going to be very entertaining for them. So if we need, and actually I do see some young faces, so that's great. So if we need a break and something to kind of pick this up, just let me know, and it's fine. We can work that out. I'm going to advance the slides. Right. Okay, so I did want to talk about the title, right? So the shouldn't ending homelessness be the easy part? That's one. Dr. Brisson asked me to come up with the title pretty quickly, so I did, and so then I had to arrange a talk around that title. But it was said both somewhat tongue-in-cheek, but also quite seriously, and I think it reflects, I guess, my own background and expertise in interventions that we know work to end homelessness, and I think also my growing awareness of kind of my own ignorance about a lot of the issues when you talk about this as a larger endeavor to really end all kinds of homelessness. There's a lot that we don't know and clear that I don't know, and so I wanted that to be reflected in the talk. And then I think this reflections on the Grand Challenge. So you've heard a little bit about the Grand Challenge and being a co-lead of the Challenge to End Homelessness. So that sounds like some big shoes to fill. We'll talk a little bit about what the Grand Challenge is, what it being a co-lead is. I'm just happy that I'm not a single lead, so that any tough questions I just defer to my co-lead who's not here right now, and you can ask her about those. Okay, I realized I probably should have had maybe like an outline so you had some idea what we were going to talk about today. I didn't do that because in some ways this talk was a little bit more organic, I think, in my own mind. But I will kind of just share, I wanted to talk a little bit about the Grand Challenge, tell you a little bit about my own background, my work both clinically and the research I do, then talk about the limitations of that research, because there are quite a few, and then also use kind of the work that we're doing at the University of Southern California and in Los Angeles, sort of as hopefully a jumping point to have these conversations today about probably matters that are more local, because in a lot of ways homelessness really is a local matter. Okay, so the grand challenges. Okay, so there's one version of this talk in which I explain the grand challenges as an initiative by the American Academy of Social Work and Social Welfare that really is focused on policy at the local, state, and federal level, where we have a robust research agenda and a plan for workforce development. And so while in some ways that's all true, it's also, I I think it would also be a little disingenuous to describe it that way because it actually isn't that clear. And I want to have more of an honest conversation with you today. So you're not going to hear that version of the talk, okay? This is going to be a different version where you kind of walk with me through what these grand challenges were and where they came from. And so for me, the grand challenges came through the work that I was doing in Housing First. And I don't know if anyone has seen this slide or this depiction of what Housing First is. And if you were at the Housing First Partners Conference that was in town, I think 2 weeks ago, you may have even seen this very slide. This is something that I developed as part of my dissertation and presented in 2009. And it's interesting going places now. I see my own slide, people presenting this, in part because of my colleagues have used this to explain it, but really talking about, for a long time how people were unable to access housing because of the requirements that these housing readiness requirements that we ask people to meet. And so in the early 90s when Housing First was developed to sort of, jump over those steps in the continuums to get people right into housing, and they actually did quite well. And so I think this is great. The plug for the book has already been made, so I can skip over this. But this is a book that I worked on with Deborah Paget, who was my mentor at NYU, and Sam Sambaris, who kind of, in some circles, is known for having developed the model of Housing First. And I worked with both of them on this book. And Sam running one of his programs as a clinical director of a Housing First program, and then continuing to do research on that. So the strange thing is, sorry, I'll go back for 1 second. The strange thing is, I think I never considered myself as a homelessness researcher, in part because all the work that I've done has always started with this model where we're really beginning with people already having access to housing. And so getting kind of back to the title, that's the easy part's done, right? I mean, it doesn't take a lot, it just takes resources, awareness to provide housing. And so most of my work has always been really more health services. What do we need to support people, help them with integration, community integration, getting jobs, being back in the community, dispelling a lot of these myths that make it so that people are kind of have these negative stereotypes of what it means to be homeless. And a lot of the work I've done has focused on the fact that there's so much in terms of tragedy about this issue, but one of the big ones being we know that people who live on the streets die decades early because of that experience, and it really takes a toll on them both physically and emotionally. So the work that I've done has focused a lot more on what kinds of support people need, and this is just sort of we know that there are service delivery models that work really well, and one of them is assertive community treatment that was developed in the 60s to keep people who had been in state mental hospitals stable in the community, and it has been used. It kind of fell out of favor in a lot of ways, but we've talked about how can we reorient it so that it's a recovery-oriented model, and you can see it really is made up of a lot of different disciplines, including social work, nursing, psychiatry, peer specialists are now typically a part of ACT models, and the work that I've done is, okay, well, what about physical health care? What about integrated care, primary care? Because people need that, and they don't really get good access to care, and that's really important. That's that early mortality. And so this is, a bit of the work that I've done and I continue to do. I think it's highly relevant today, especially, we still have the Affordable Care Act, which is great, and in a lot of places in California in particular, we're starting an initiative in health homes. And I think this is a good model, not just for these types of programs, but I think the kind of assertive outreach we need in the medical system so people live healthier lifestyles is really important. So I actually think this is a good model for any sort of patient population that has complex needs or chronic conditions and things like that. But I did want to share, I think what has changed my work and what I just wanted to spend a few minutes talking about today was some research, right? So research at least can be useful. It was useful to me in the sense that this was some work done by some colleagues of ours at the University of Pennsylvania, Dennis Colhane and Tom Byrne. And what they did, and I'll explain what this graph is in a second, but they were looking at the age distribution of people considered to be chronically homeless. And they mapped that over time, right, looking at like kind of the census years. So you can see in 1990, the average age of a person experiencing chronic homelessness was about in their mid-30s. And then you can see 10 years later that the average age moved up, And 10 years after that, the average age, and today it's about in the mid-50s, someone experiencing chronic homelessness coming into housing programs like Housing First will, for the most part, their average age will be around their mid-50s. So why was this important for the work I was doing? Well, in part, this kind of crystallized what, as a clinician, I think we had seen and we had known, which is that, you know, there's a higher increase in disease burden that people are experiencing as they're getting older. And I think the other thing that is not really, when I see this chart, what I see is when Housing First was developed in the 1990s, that's when people were in their mid-30s. The kinds of support you need to offer people when they're in their mid-30s looks very different. And I don't know that we've really had the conversation of if these programs are supposed to be for this target population, then what are we doing about the fact that we haven't really changed that program model and they're much older and they have different needs at this point. So that is kind of, based on that, that's really what led to a current project that I'm working on that was funded by the National Institute on Aging. We call it the Tenants Aging in Place, or TAP study. And this is one where we worked with 2 community partners in Los Angeles, Skid Row Housing Trust and Downtown Women's Center. And what we did is we recruited a representative sample of their tenants, 237 people altogether. And initially we were going to recruit people who were 50 and older to look at some of these age-related conditions. And when we talked to the clinicians, they said, you know, those issues that you're talking about, we feel like we see in people that are younger than 50. And so we actually changed our criteria so that people 45 and older could enter the study. And what we were looking at is just prevalence of a lot of these issues that often you talk about with much older adult populations, right? So kind of activities of daily living impairment, things like fall risk, balance, walking difficulties, urinary incontinence, and frailty. Frailty is kind of a big one, especially because it leads to mortality and hospitalization and that sort of thing. So anyway, I'd like to just move quickly almost to the results, but that is to say, you know, our sample is pretty much what one would expect in the sense that, you know, the average age was 57. They had been in housing on average, you know, between 4 and 5 years. They had a long lifetime of duration of average 8 years. You can see that we had more men than women, but a little higher proportion than you might expect of women. That's because we were working with Downtown Women's Center, who exclusively serves women experiencing homelessness. And then, you know, of course, this is an issue that disproportionately affects African Americans in this country, and so this is kind of what you see, and you know, for obvious reasons of institutional racism, and that just carries over into the homelessness as well. And so the demographics of what we, you know, saw was not surprising at all. I think what was surprising, look, going into this, I think we knew, okay, the reason that there's a study is because it's an issue. I don't think we realized how much of an issue it was going to be. And so I'll just explain what this graph is right here. This is, you can see at the bottom, these are all the conditions we were looking at. And this is the prevalence that we saw in our sample in the blue bar. Okay, so if you take a look at the blue bars, you'll see for the most part, you know, a lot of these conditions, up to half the sample was experiencing that. And some upwards of 50%. And what's striking about this, now let me tell you about the red bar. The red bar is, and this is all forthcoming that we're going to publish, and probably know when I actually read the article, but I'll tell you about it right now, which is the red bar represents a comparison group of a community-based sample. So people that probably, though weren't asked, probably had not experienced homelessness, or at least any time in the recent past. And the striking thing about this is a community sample of people who are age 70 and older. Okay, so a much older comparison group, and yet you can still see the difference in most issues. Urinary incontinence, it's about equivalent, but everything else you see a lot higher rates in the group that's in housing. Okay, and so one of the questions is, okay, well, so we know that now. What are we going to do about that? And this is the phase that we're in now with our community partners about, okay, what interventions are out there that we know works with older adult populations to increase their memory, to increase their balance, so that you can reduce fall risks. Falls in particular, I'll just mention that you know, half the sample experienced a fall in the last year, and some people had multiple falls, and then this is something we're working on right now, but when you drill down, to we ask questions about, okay, where did you fall? A lot of it's in their unit or in their building, right? So these are issues that can be addressed by housing programs if they're talked about and if they're planned for. But currently, you know, the staff, this is something we're working on. So these are all evidence-based practices that we're trying to work on and figure out, you know, do staff have capacity to do this? And in what ways, right? And so this really, in some ways, this is the pilot of what those next steps should look like. And the other part of it is we're having conversations too, because Los Angeles has a healthy aging initiative, and that's a kind of a community initiative. And you know, I think a lot of times the housing and the homeless community, they're providing services too, often to people who are aging, but those two worlds obviously, and we know this, are pretty siloed and don't talk. And so we're trying to figure out how can we integrate that a little bit more so that the healthy initiative, aging initiative in Los Angeles also considers and includes some of the work that the permanent supportive housing providers are doing. Okay, so I think what I just wanted to sort of reboot for a second and get back to the title, because again, everything I've been saying to now is still within that framework of we know that there are effective interventions, namely Housing First, for this target population. And so we should be figuring out how to scale that up and do it better, right? And so that's a big issue. But it's still, you know, to be clear, Housing First is still what we would call in public health a lot of times is a downstream approach, right? It's way after the fact. It's when people have already kind of experienced adversity, and we're there to help to pull them out of the stream while they're downstream. And the question really is, okay, well, what about some upstream factors? And I think this is where when you're talking about chronic homelessness, that's what you're dealing with. You want downstream interventions to fix that issue. But the reason people got there, Housing First really has nothing to do with that, and it might be a small corrective for bigger problems, but what are some of those upstream issues that we need to deal with? And so that's, right, so that in some ways is, and we'll talk more about this for, I guess, in some ways the remainder of the talk, but I wanted to, you know, these are things that I feel like in the past 2 years have become a lot more clear to me, and so I just wanted to share some of them with you. So what do I mean by, what are some examples of these upstream factors? Well, okay, again, there are a lot of visuals here, so I'll talk through what these are. This is a graph that Dolbear looked at where they charted basically HUD's budget for different funding streams that create affordable housing in this country. And if you take a look, and the years are along the bottom there, starting in the late 70s, you can see this precipitous drop in funding for affordable housing, right, into the early 80s. And that never really recovered and still doesn't today, and if anything, the budget is getting cut more. And I don't think it's a coincidence that when you look historically at street visible homelessness, which in some ways didn't exist before the early 80s, at least not like that, it's no coincidence that at least in my mind, that the drop in funding for affordable housing coincided with this increase in our problem of kind of modern day street homelessness. So that's just taking a step back, looking at what some of those upstream issues are. I think the other thing I wanted to share with you, and this is, again, this is all, as you look at what other people are doing, kind of blown away by some of the simplicity of what the work they do and the importance of it, and I often wonder, well, why didn't I know about this before? But this is basically a chart looking at housing subsidies that this country provides. And if you look in the yellow, these are kind of those direct subsidies, right? This is the Section 8 programs that go to kind of on the lower income earners are eligible and receive that funding. You can see the vast majority of the housing subsidies, and of course this all changed with tax reform, and we can talk about that too, but the vast majority of the subsidies in this country for a long time were through basically the mortgage interest deduction, which disproportionately is provided to people who have more money, just because of the simple fact that the larger your mortgage, the bigger your house, the more interest you're paying, the larger deduction you can take. And to be clear, that is a subsidy. That's a subsidy that's rooted in housing, but it's directed at people that pretty much could afford housing even without that subsidy. And what I really found interesting about this, and look, who knows political leanings here, and we don't need to get into it about this, but if, you know, the federal government, the Congressional Budget Office, did an analysis and said, look, if we cap that mortgage interest deduction and redirected it to people in need, actually the Section 8 program could become an entitlements program the same way that food stamps was. So if you qualify, you get it. Not if you qualify, you go on a list, and some point 20 years from now, we might have the money for it. So, right, so the point is we do provide subsidies, it just is not going to the people necessarily in need. Okay, so look, I don't think homelessness is just a housing issue, but housing sure is a big part of the equation. And I think nowhere, for me, is that more clear than in Los Angeles, where we see these quite staggering rates of people who are unsheltered. And actually, for those of you who are, I think a lot of people look at real estate and home values, and so if you know the website Zillow, right, that track this stuff, they actually have amazing data on housing prices and on the rental market, and they have some economists working for them, and so they did an analysis of the kind of housing market and its relationship to rates of homelessness across the country, and at least in Los Angeles, they found a very direct relationship between increase in rents and increases in rates of homelessness, so that for every 3% that rents go up, you can expect 2,000 more people to become homeless that year, right? And it was a pretty, controlling for all other things, a pretty direct relationship. So look, the housing market, it's a big one. You know, I'm not an economist. I don't have a background in studying that, but it's hard to really talk about this issue without also talking about housing markets. And so I don't know how many developers or other people we have in this room here, but that needs to be part of the conversation. You don't have to self-identify. I was just looking for if anyone wanted to share that. Okay, and you know, in large part, I think because of the visibility, at least in Los Angeles, of this issue, there's been quite a bit of movement and action on this issue and people coming together in kind of these conversations. And so a couple years ago, the county, which notoriously didn't work well with the city and there were kind of issues, they came together and they did form an action plan. And look, there are plenty of plans to end homelessness, so I'm not saying this is necessarily something new. But the specificity of this plan was pretty impressive. Even though I'm always suspect of a plan that has 53 strategies to address something, but they really were trying to think this through, and so the action plan that they came up with has 6 different areas they're looking at in those 53 strategies, and in part, and I'll talk about this more, but in part, Los Angeles is now in a place to do something about it, and because there's more money coming in, and voters have approved an initiative to tax themselves, which is pretty remarkable to address this issue because they want to see some change. So I actually think Los Angeles, despite having kind of the largest unsheltered population, which I keep saying that in comparison to New York in general has more people who are considered homeless, but the majority of them are in shelters and their families, and they look different than out in California, and so right, and so I think we're at a place now where Los Angeles, because they didn't necessarily develop a extensive shelter system, is maybe in a better place to now implement permanent solutions to this. So they're not kind of as crippled as a place like New York that's sort of on the hook for spending money on temporary fixes. What I did want to talk about, and this gets back to the science, is so me and a colleague from the Department of Public Health in Los Angeles looked at that plan, those 53 strategies, and what we tried to do was put those strategies within what we call a prevention framework. And I won't get into this too much, but this is prevention frameworks are been around this idea of kind of primary prevention versus secondary and tertiary prevention. as sort of a public health framework. And we looked at what they're trying to do, and we saw that, and you can see in the strategies, there are a lot of these strategies that go across all three levels. So let me say it a different way. Primary prevention being, okay, how do we keep people from becoming homeless in the first place? Secondary prevention, this is kind of shorthand of, okay, if someone is experiencing that or at imminent risk, what are some immediate steps we can take? And then tertiary is, what do we do with people who have been out there for a long time, and what are some effective solutions? And so you can see some of their strategies really cut across all three. And then we have some strategies that are very specific to each kind. And anyway, we put this in with a kind of a larger health equity lens framework and how that then could have an impact, these strategies, on things other than homelessness, because I think if that's the so back to the title, if that's the only outcome you're interested in, you're missing quite a bit, right, in terms of rationale for why we want to do certain things, because it's homeless. There are plenty of other important outcomes related to jobs and family and well-being that are important and relate to that. So we were trying to put this at least in a health equity lens. Anyway, all that is to say, getting back to this, what we also note in this article that should be coming out soon is that we know the most about tertiary prevention, right? So we know the most, if you just look at the science and the research that's been done. There's still plenty to do on things like Housing First, but there's been, at this point, randomized control trials that have looked at it. The Canadian government did a 5-city randomized control trial of people in Housing First and regular care. We know that, right, there are pretty good interventions for chronic homelessness. A lot of people talk about rapid rehousing, but I'm just saying from a scientific standpoint, there's a lot less information on who that works for and whether it works and when we should use it. And so rapid rehousing is the thing that people talk about and are using, but in terms of the empirical support, we know less about, but there is some. And I think the biggest gap, and this is kind of getting back to Dr. Jensen's work on the power of prevention. In homelessness, we don't really know much about primary prevention at all, and how to effectively target people who would become homeless. And so there is some interesting work being done, and out of Chicago in particular, I just saw a presentation this week of where in their 311 system, where people who are in need can call. They actually, because on any given day, the county either has money or it doesn't, so some people call in and they'll get it because that day there's funding, and other days they don't. But in a way, this created a natural experiment, and they were able to look at it. And so people the thing is, it was a pretty strict criteria of who qualified for primary prevention. But at least that's one of the few studies I know that looked, and there were ways to effectively target people, and had much higher success looking at that. But anyway, we can get into that. The point is just that there's a gap in that knowledge. So how am I doing on time? Okay, perfect. So I think that there were kind of two more domains I just want to talk about, and then I'll wrap up and we can hear from our panelists and get questions. But turning a little bit now to the work that we're doing at the University of Southern California, I wanted to just bring this idea to you about anchor institutions, and I don't know if you've heard a lot about these, but right, so there's some work that different people worked on. This Democracy Collaborative have a good kind of manual on it, and I have a colleague, Hortensia Amaro at USC, who's done work locally on how universities in particular in Los Angeles can serve as anchor institutions. But these could be hospital centers and any kind of big, they could be schools. Like LAUSD could be considered an anchor institution. But what's the role that they have, right, in addressing some of these community issues? And can they play a bigger role? And so I wanted to kind of give you a few examples of the way in which, so now our university, not just the School of Social Work, not just the Grand Challenge of Social Work, but our university has an initiative to partner with the county to help address homelessness. So I wanted to give you a few examples of the way in which the university is trying to take its resources into addressing homelessness. And I think one, you already heard earlier that for a long time the county wanted some help in doing the point-in-time count, the Greater Los Angeles Homeless Count, and just issues around methods and how to do it better and how to get more accurate numbers. And so that's something I think when I first got to USC, the message was something along the lines of, as a scientist, I don't know that's the best place to put your time and effort, because that's not sort of National Institute of Health funding, and that's really what you're here to do. And that message has changed in the time that I've been there. And so, and I was actually, it kind of came full circle. It's like, oh, well, do you want to go help now? So it was great that just that kind of culture within the university shifted in that time period. Another example I wanted to share with you is a partnership we have with the Los Angeles Police Department, where, of course, this issue of excessive use of force is one that is an important one. And so this is a volunteer training program, a certificate program for officers out in the field who want sort of advanced training working with different populations. It's not just focused on homelessness, but I was able to participate in terms of officers working with people experiencing homelessness and issues around de-escalation and what they could do there. So that's just an example of, I think, the role that the university can play in some of this. The other thing I wanted to bring up, and this is the website of a recent center, the Homeless Policy Research Institute. So it's a new institute that was funded through the Hilton Foundation. So it was and the United Way. It was a collaborative joint effort, and it's a policy research institute that's housed in our public policy school at USC, but really it came about because policymakers at the county and the city had been coming together with practitioners, and so there was a good group and kind of a funders collaborative on ways to address this, but they would always have questions that they needed answers to, and they needed data, and they wanted a group of researchers who were interested in this. So the Homeless Policy Research Institute is basically gathering local researchers from across different institutions who we've been doing this for about 6 months, and getting a sense of what are the questions that are really of immediate importance to the county, and how is the research that we're doing, how can we provide them with better information. So just as an example, one of the first things that came out of the center, so we have these policy briefs, and the first policy brief was based on the tenants aging in place study, where we were able to kind of frame the issue, show the actual data and the supporting statistics, and present a few key findings or takeaways for policymakers. And one is that issue just around of training, right? So if you're doing homeless services and you're working in this, you should be trained a lot in issues around gerontology and aging. So that was one recommendation. I think another recommendation, and this was actually nice because it was immediately actionable, which is on any given year, there's always kind of excess funding that people just need to spend at the end of a fiscal year, which I still have never understood that. But anyway, that's what needs to happen sometimes. And so it's like, what are you going to spend that money on? And so one takeaway was all of these units out there that people have been living in a while are not necessarily age friendly, and they need to be retrofitted for handrails or better lighting or a lot of these kinds of issues. And so now with this, there's a lot that they're planning to use that one-time funding to actually go around and make these modifications to apartments. So that was like a very actionable thing. And I have to say, as a researcher, when what you do actually seems like it has some kind of impact, it's just like it's pretty amazing that that's even possible, rather than just writing an article that I'm not sure how many people read. Anyway, so the Policy Institute is another one, and it was pretty exciting last night hearing more about the Burn Center, because I think in a lot of ways that sounds very similar in the idea of what a center like the Burn Center could offer and the role that it could play locally and in the community. Okay, so then the last point I'm just going to talk about, and this gets back to, Measure H was, I think I referenced earlier, this was one of the county initiatives that was put on the ballot. And the amazing thing is, in order for these tax initiatives to pass, it has to be done by a 2/3 vote. So you rarely get a 2/3 vote on anything, let alone something where people are taxing themselves. But this was a 1/4-cent sales tax, and all the money goes directly to homeless services. And so in the county, what that translates to is $350 million each year for the next 10 years. Those are the projections, which is in a lot of ways a game changer, right? Because right now there are 1,000 new job openings in homeless services in Los Angeles. So this is what I'm saying, that kind of opportunity that feels a little bit like a once in a lifetime thing. the issue now, for us at least, is where are these people going to come from, right? I think sometimes people forget about that. I mean, people want to work, right? But they don't necessarily want to work in homeless services. And even in social work, that always amazed me. That's maybe not a top pick. But even if you find the people, it doesn't mean that they're trained necessarily to do the work. So that's important. You could hire up a bunch of people, but retention and making sure they do good work is an issue. And even if you have trained people, it doesn't necessarily mean you're going to have leaders, right? And I think leadership is going to be really important in this work. And at least what I've noticed is there are some very good people in homeless services, but there aren't enough. And so at least what I've seen is local agencies basically hiring the same people back and forth for different jobs. So we just need more people who want to do this work, who are trained, and who can make a difference. And so that's something that I think, at least in the past 2 years, we've had basically an enhanced training program for people in homeless services to get them in for a few reasons. One, so that they're part of this larger conversation, so they realize, especially students, if they get placed in a homeless shelter and they don't really see the bigger picture, at least they can have that conversation and understand that they are part of a larger movement that's important. And I think that makes a big difference for people in order, in terms of sustaining their interest in the field. But I think the other point is around these systems level issues, the policy issues that are important. In addition to increased sort of clinical training that we provide those students, it's also those system level issues that are important. So that's something that our school is trying to do. We're working collaboratively with other schools of social work in the area. And again, I think, I just think locally that's a great area for DU that it could work on. All right, so kind of wrapping up with one more final caveat is, so like I said, this is a talk about the Grand Challenge to End Homelessness, which is an initiative that looks at policy, practice, and research, right? And there are gaps in knowledge that we're trying to address, particularly in prevention. And we want to bridge that gap between research and policy and answer those important things and that workforce development. So in the end, I kind of did do the talk. I just did, like I said, it was a little bit more organic, and I wanted to get you there. I think one of the things, there is a website that a lot of these ideas that I've covered and some of those charts and diagrams, if you go to, it stands for Grand Challenge to endhomelessness.org. And so you can find a lot of the materials on there. What I did want to kind of wrap up with is, not to get too academic here, but just in terms of how we think about the issue of homelessness, I wanted to raise 3 sort of ideas that I don't know exactly how they fit in, but I do think that they're important. And at some point we'll be able to articulate this probably a little bit better than I can today. But one of them is the work that I'm doing with an economist, Robin Cox, at our school, where she has a history of doing work on food insecurity and was part of some of developing measures of food insecurity that we use nationally to look at the issue, to measure it, and then to make policy decisions around things like food stamps and ways to address food insecurity. And she's basically in a few papers is advocating for, why don't we have a similar measure of housing insecurity that is standardized, that is used across communities, that it's not just income to cost of rent, but factors in a lot of things that can be used to address issues like those housing subsidies and where they go. Right, they should go to people. Housing subsidies go to people who are housing insecure, and homelessness would then just be within this larger spectrum of housing insecurity as an extreme end of that continuum. So again, a subtle sort of reframing of the issue, but I do find a lot of times this issue of what we're talking about, and look, there are separate issues, but what we're talking about with people living in poverty and people who are homeless, there are often there's a divide between those conversations, but to the extent that there's a lot in common too, that I think this is an interesting way to think about it. The other one that I will not be able to do as much justice, but Chris Essert, who's a lawyer and a philosopher, has a really interesting argument about this issue of property rights, and I'll try to say what I think his argument is, and you can probably read the paper and be as confused as I am. But there's something in there that's important, and he argues something along the lines of, look, private property is not a bad thing. It's a good thing in this country. People need private space to live their lives, and it is something that the estate sanctioned, right? So if someone comes into your home, you pick up the phone and call the police, they will remove that person from your private property, right? People who are experiencing homelessness don't have rights. They don't have private space. They don't have private property. And the argument goes along something like, you can't have private property and public space with people who have some access to that as well. Otherwise, the system will sort of fall apart on itself. And so it's a, again, it's an interesting argument. I'm not sure exactly the implications of it, but it's kind of worth thinking about. And then the last one, I just wanted to, there's a great book on the defense of housing by some professors at Columbia that again, maybe won't do the book justice, but they basically make the observation that at some point in the past century, housing has gone from primarily a place where people live to what we could call monetized or commodified, so that it in some ways it's closer to a storage of wealth than it is a place where people live. Meaning that in some ways, owning property or owning housing is, you could be buying gold or silver. And there are some places where people don't even live in the apartments, right? There are investors who just buy it and no one's living in it. And I think they make the argument there that, and the system and in terms of how that's financed and who gets mortgages and who doesn't, just sort of perpetuates that. And I think, and this is maybe this is my take, but I think part of what they're arguing is what we miss in that is the idea of housing as a public good, right? It's not just something that people own and it's for people of privilege and investments, but in the same way we have roads and streets that are meant that there's a public benefit to it. I think that there's a public benefit to using housing for at least some portion of the market for what it was intended to do, which is a place where people live. So again, I think these are probably arguments that are all related, but I couldn't figure it out for today, but I did want to share those with you in case they spur some thoughts on your own. So anyway, I think I'm within my time. I do want to thank you for listening today, and I look forward to having the conversation with you in a little bit.
That was a insightful, thought-provoking talk, Ben. Thank you very much. And as I said, we're going to do some listening for a little more, but then we're going to get a chance to engage. I did just want to say, Ben, that when you said there's 1,000 new jobs, there's one table here that has a number of students that I know of, and their eyes got wide, and they're like, Los Angeles, all right, well, sunny there too, and yeah, they know who they are. They're laughing harder than everybody else. So we have the pleasure of having Livia Davis here from Massachusetts. Livia is going to provide us a response to Ben's talk. We're going to hold questions until after Livia's talk. If you're looking at the schedule, please don't worry. I am looking at the schedule too. That's my job. And so we're going to have Livia talk for about 5 or 10 minutes, and then we're going to take questions. We'll probably take questions till about 10:30, and then we'll take our first break, and I'll amend the schedule after that. So Livia, if you could come up. Livia is an MSW. She is the Chief Learning Officer at the Center for Social Innovation. She is responsible for the development and ongoing management of learning strategies and organizational capabilities needed to ensure alignment with strategic division there. Ms. Davis is also the director of the Bassick Center on Homelessness and Vulnerable Children and Youth. The Bassick Center, interestingly, is a collaboration of service providers, clinicians, program developers, researchers, policymakers, and activists, with the common goal of ending family homelessness in America. And to me, that sounds about right? That's who we need together. A little more, Ms. Davis has over 14 years of experience as a direct service provider, working in behavioral health, housing, and homelessness services. Ms. Davis also has firsthand experience working in a large recovery community in Denmark, started by her great-grandfather in 1912, which influenced her passion for recovery, housing, and communities. There's a lot more to say about Livia. I'm going to finish by saying, well, Livia, you might want to say some about some of your technical assistants, but I'm just going to finish by saying Ms. Davis has been featured in various national media, CNN, The Washington Post, Boston Globe. Some of you have probably heard Livia speak before. She is an innovator, and we're really, really pleased to have her respond to Ben. Thanks, Livia.
Thank you.
Please take a seat. Yeah, that'd be great. Would you rather sit?
No, that's fine.
I'm going to stay and make sure this is working for you.
All right, can you hear me? All right, so it's a pleasure to be here, and I think I have about 5 minutes, but I'm here all day, so I have more time to talk, which will be great because I love dialogue and learning new things. So just a word about me so that you understand a little bit of where I'm coming from in responding to some of Ben's presentation. So the farm in Denmark that I grew up in was started in 1912. It's still in operation, survived 2 world wars. And my great-grandfather started it because he said, people who are homeless and coming out of prison, they need a home. They need a home, not just housing, they need a home. And so he started this farm that now we have 125 people living on at any given time. And the kind of core principles were interdependence, community, sharing meals, sorrows, and joys together. And since 1912, probably about 7,000 people have gone through the doors. You can stay there as long as you want. We have an assisted living component there now. People have stayed there till they died. Some of them move off, and go back into the community. So that's my kind of background in coming before I came to this country. And so when I came to this country, I got trained as a social worker at Boston University. And one of the things that really struck me in that training at that time was that I was told that I should not have relationship and share personal things with people that I was seeing as clients, so that I was the trained practitioner, but there was a boundary that did not allow me to connect with people in a way that I have been grown up with, that you relate, you do things together, you are interdependent. So that in a way was trained out of me, if you will, because that's what the training at that point said that we should do. So then I entered, the homeless workforce here on Cape Cod, actually, in Massachusetts, and I did a lot of permanent housing, transitional housing, and shelter work, and I also helped start a healthcare for the homeless. And so in all that work, I kind of kept that boundary where you don't kind of share of yourself. You don't share your own challenges. If you're in recovery or if you have trauma or anything, you don't share that with the people that you're there with. That always bothered me a little bit because I couldn't quite kind of figure out, what do I do? Because these folks are people and they have the same challenges that I do. So I share that because when I listened to Ben's presentation, and it's so true, housing is an absolute essential component. We have to have it. And understanding what housing and services need to be in place for different populations that experience homelessness is key. But we also need to figure out, how do we develop communities? How do we develop non-clinical services that can make people feel that they have a connection to their community? That is critical, and that's something I'm very passionate about and that I've been doing a lot of in the last 6 years. And we can talk more about how to do that through recovery supports, or through how do you create a health, how do you create community, how do you create purpose? And so all those things need to be there. The other thing I'll say is that because of my background, I had a lot of kind of a practical experience about what works. So the model in Denmark, you can't convince me it doesn't work because I have 100 years of data, right? But there's no research that says that model works. And so I think the importance of having practical provider experience coupled with the research is just so important, and we need to figure out how to do that more often. And as you said earlier, having people with lived experience, the people who are going through the programs, they have to be at the table. And I think that's the most exciting thing that I'm seeing much more of, is that piece, that you're really seeing, people coming in at all levels of some of these programs and saying, you know, if you want to design this program for me, here's some things you need to know. This is how it impacts me when, you know, you talk about me in third person, or if I'm not here, or as a patient, or whatever it may be. The other thing that I thought was really very exciting, Ben, is that the training of the workforce to work with homeless, people experiencing homelessness, families experiencing homelessness is so critical. When I first started, I was 6 months out of graduate school for social work, and they put me in charge of a homeless shelter. And most of the people that, I didn't have any experience running a homeless shelter. I knew how to run, you know, be in a homeless farm, but a homeless shelter where you had to leave at 8 a.m. in the morning, I had no idea. And the people who came in to be part of that workforce, they had no training. They had no training. I was the only social worker. And so you had, you know, 500 people being served by a shelter, and you had one trained social worker, and very little understanding of the complex needs that people have because of trauma, homelessness, mental illness, and so forth. I will have a few more kind of statistics of some of the mental health kind of challenges and trauma challenges in my remarks later, but having a trained workforce is absolutely essential, and I'm just so happy to, and I can't wait to hear more about that, because it's such a need. We do need people in lived experience in those positions, but the complex needs, we absolutely also need the trained workforce. So anything I can do with that, we have a lot of experience. We have a lot of training programs at the Center for Social Innovation where we have done training all over the country with the behavioral health workforce to say, this is how you become trauma-informed. This is how you help people who are in recovery from addictions or mental illness or all of it together. How am I doing for time?
That's great.
Yeah?
Do you want to say
No,
more?
that's good. I just want to make sure. So Ben, I just want to say, yes, housing first, it's a great, great model. And I think if we can figure out how to apply it to others, I think that's right. But I also want to say that we really need to pay attention to the service model you attach to that housing intervention based on the population that you're trying to serve. Families have very, very different needs than the chronically homeless. We know that. Veterans have different needs. And so we can't just say, okay, housing first, or permanent housing, or transitional housing, whatever model it is the one that cures all of that. It won't work that way. And so the nuance and the passion you have for different populations, keep it on, because we need that.
Thanks, Livia. Thank you, Livia. I'm going to stay seated here because I am not the highlight. Actually, this is where we start to have you all highlighted. So Ben and Livia are here for questions. We have Abby, who's walking around with a mic. If you have a question, please raise your hand, and Abby will come find you.
My name's Randall Loeb. I've been chronically homeless in this country, in Denver. Almost 20 years I've been involved in this as a result of it. I wish I didn't know what I do. I used to see the lines outside of Stout Street Health Center and wonder what they were about. I used to listen to Parvinsky at the Colorado Coalition for the Homeless, which I'm involved in. I lived in the Catholic Worker House. I find that the model of Marisol in Catholic Charities and places like Irving Street and the VOA and family-oriented programs and places like that where there's no hierarchy are actually superlative. I lived in the Catholic Worker House here until it was burned, actually, a couple years ago. I feel very strongly that we need guest houses, as Rumi said, a place where a person can dwell. There's a program called Citizen Advocacy that exists in Chester County, where I used to live near Philadelphia, that believed that every average citizen could collaborate with each other in shared living arrangements and in life sharing to help people to be self-sufficient. I suffer from a bipolar disorder, which I was born, and in Giel, in Belgium, as you may know, there's a program where a woman was thrown out by her father and decided that she would take no part in it and make sure that any person with a disability had a place that was safe for them. Until our world can come to the terms of redistribution of wealth and revolutionary love, as Valerie Sauer says, where we actually have a place for us, no matter what, where we're safe until the day we die, I think we're talking nonsense. And I want to set the tone for that for everybody in this room, because I can tell you any person that lives in a place that is not secure, safe, and so forth for the rest of their life is living in jeopardy. And there's no excuse for a child or a person of my age to be in that experience.
Thank you, Randall.
Thank you, Randall. Hi, my name is Ian Fletcher, and I work for the Continuum of Care here. And I had a question kind of connecting both of your work. So especially talking about the workforce development and a lot of the, especially the Spark report that just came out about anti-racist communities. In our community, the predominant leadership looks more like me than it looks like the community that we're serving. And so I'm wondering what role you think the Academy has as we're talking about developing that next group. How do we make sure those 1,000 folks, new jobs in Los Angeles and certainly here in Metro Denver, look more like the people that we're serving and are equipping folks to be trained?
Sure. So the Spark report, of course, came out of the Center for Social Innovation by my colleague, by Mark Dones and Jeff Olivet. So I know a little bit about the work. What I can say about how to make sure that you have diversity in your workforce is two things. The recovery movement, I don't know if you know a lot about the recovery movement, but there's a huge recovery movement as well in this country where really people are saying if you want to have programs that really help, you need to include people who have lived experience. I think from that work we can actually learn a lot about how to make sure that the workforce that you have does reflect the people you're trying to serve. It takes some courage, but it also takes leadership more than anything, where you make a commitment that whoever you're hiring will reflect the workforce. Sometimes it's a decision that you have to make that no matter what, you will hire people with lived experience, you will hire people who reflect who you're serving. And it's not an easy habit to break. I can tell you at the Center for Social Innovation near Boston, about a third of the people that work with us, that work as employees, are people in recovery. We still don't have the diversity we want, given the people that we serve, but we made a commitment, and that meant that we have to change our hiring policies. It has to be how we go out and do outreach, how we supervise, how we have our meetings. It has changed our whole culture, and we have to make that commitment. So part of this is easy, it's making a decision, but it's really hard to implement. And so you need someone in charge of doing that, hopefully a change committee within your continuum of care. And then I think it has a lot to do with where are you recruiting from? Can you talk to whoever all your sites are, your schools of social work, and help them also be the ones who refer? But it takes a commitment, first and foremost, is what we've learned.
And I might add, I think that's a great point, and it's a problem, not just with providers. I mean, I think we see that in kind of our academic community or research community and providers and policy. And so I don't have an easy answer to that, but I do, it does occur to me that when you talk about these 1,000 new jobs, there's not really a good mechanism for people who have had this lived experience to then get into those jobs. And I think we need to talk more about what it would look like to create those opportunities, because just talk about dedication and meaningful work. I think that I think, like we heard, it makes a big difference. And at this point, I think it's just trying to get things off the ground without having those points really well taken. Yeah.
And I think I want to add just one more thing. So for people with lived experience on the recovery side of the house, behavioral health, there are now 36 states that certify and train that workforce. And so, and lived experience is an essential component, and how you share your story is an essential component of how you're trained and how that workforce is used. So there's probably about 5,000 trained peer specialists now in this country. Could do something similar for people with lived experience of homelessness who are trying to get into this workforce, really putting together a standards and certification and competency training. And there's a lot you could learn from the recovery movement to do that. And that might be something the schools of social work and homeless service providers could do with people with lived experience.
Thank you. Other questions?
Hi, my name is Liv, and I'm 11. I had a question about, so I did a project about homelessness at one point in the school year, and I had a question. In my report, it said something about there's about 10,555 homeless people in just Denver. What % of that population would be children and adults?
So I can give you a national statistic on children and families that are homeless. I don't know about Denver, but it might be very similar. So the way you want to think about children, you have 1 in 30 in this country are children. So that means 1 in every classroom. If you have a classroom of 30, 1 of every 30 is a child. That's what the national statistics show. So in New York City, we did a lot of work last year to do some work in their shelters, and they have about 12,000 families at any given night who are homeless. And of those, 51% of them are less than 6 years old. So 1 in 30, and half of them are under 6 years old.
The other reason I was nervous about when I heard that report that their schools were maybe closed today is I feel like young people always ask like the really hard, good questions, and so we often don't have good answers for that. So I appreciate your question. Thank you.
Yep. Yep.
Thank you. Other questions?
Good morning. My name is Arthur McFarlane. I work at Children's Hospital, Colorado, and I'm a population health analyst. I spent 25 years working in the Department of Public Health and Environment. And what I'd like to do is to take you back to your slide that you had up with your primary prevention, secondary prevention, tertiary prevention, and ask the question, when are we going to begin to have the conversation that starts to include everyone in the conversation, i.e., we can have research that has clinical outcomes. We can have research that has public health outcomes, but when are we going to have research that has both in it? When are we going to start to have conversations that involve social determinants of health in a full conversation about not just homelessness, but all the social determinants and how we start to break those apart into a conversation about which ones really are part of homelessness as a primary cause and which ones are part of homelessness as a primary prevention?
That's a great question. I think the it's interesting, this grand challenge. There are days that I don't even really know that it's properly conceived in the sense that there are times when homelessness as the problem unto itself is really important. And there are times where, homelessness is pretty much a symptom of a lot of other things. And at least the way we're taught to do research, you're told to pick an outcome and to look at it. And so it's hard, that variable view of the world, it doesn't help so much these larger conversations. And so I think even that, I've referenced that the project in Chicago that's looking at primary prevention for homelessness, and they were getting pretty good results. But still, when you look at it, it's hard to justify the expense if you're only concerned about homelessness. And if you broaden that scope to look at, okay, well, what impact does it have on child welfare and the justice system and things like that? And I think in some ways we've seen the reason that Housing First had become an acceptable way to do things as much as effectiveness is because there were arguments made about the larger impact it has on multiple systems. And that's kind of in some ways a unique situation that worked in favor of disseminating a practice that, works for homelessness, hopefully works for other things too. So I'm with you, I just don't know, I have a great answer of the immediate next steps.
Others? This will be our last question. Right, Abby?
My name is Mimsy Tackney Moen, and I'm a graduate of the DU School of Social Work. I am now retired and interested in this issue. And I was a VISTA volunteer way back in the 70s and worked with lots of housing projects. And when I hear housing first, the question I have is, are we going to be segregating the poor once again? And any ideas about how to avoid that?
So, given my background, and really having a community be the primary way to help all of us overcome homelessness. I mean, I love housing first, but my deep belief is actually it's community first. And we all need community. We all need places to live. We all need families or friends or neighborhoods, whatever constitute a family. And so. I really hope that we do not look at segregating and having people, living in different enclaves, because there has to be a very active and proactive way of making sure that we all learn from each other. And I think one of the ways to do that is to have people with lived experience at the table at all times, working with all of us, providers or developers or whoever it is, because that will help that. It's one of the surest ways that I know to make sure that that does not happen, is to have people, there at the table.
I think that the other thing I just want to say is when I think of housing first, I don't think of the housing part. I mean, I know that that's the focus. I think of really the premise of it was based on giving people choice, and what people were asking for was housing, and that's how it ended up that way. And I think the programs that I see most successful do their best at giving people choice of where they live, with whom they live, and I think even to Randall's point earlier that people should have choice if they want to live in a therapeutic community or on their own. But your point about all of these models, it's housing in places where that's affordable, and so there's always going to be, I think, with these programs that kind of segregation. I guess the issue of the more we can increase choice so people can have options, there's a larger conversation about the single site idea of you have a building that people go into versus a more scattered site where it's Section 8 and then people could choose where they, I mean, I've always sort of been a scattered site kind of person for those reasons of choice. But again, if there are options, then I think we increase the chances that people will find the community they're looking for. And some people I think choose to, in part because of a lifetime of trauma, have a little bit more just isolation, and so that needs to be addressed too. But it's a great point.
Thank you both, Ben and Livia. Thank you for starting to participate. The day is going to go on, and we're going to have more of your participation and engaging more. Let's take a break, and we'll reconvene at 10:45. For those of you who need it, there's a bathroom down this hall, a men's room, a gender-neutral bathroom down further down the hall, and there are also bathrooms upstairs.
Okay, we're going to get started. If everyone can come back and turn your attention up here. Lively conversations. It's wonderful to feel the energy in the room. My name's Kim Bender. I am on faculty here at the Graduate School of Social Work, and I have a real passion for understanding youth homelessness. So it's been a pleasure to be here today, and I'm so excited to hear from our panelists for our next part of the event. We have selected experts who specialize in different subpopulations within the homelessness community, and we've asked them to prepare 10 minutes, and they've been asked to answer these questions. What's the current state of local, state, or national policies that impact your population? What policies and practices are working positively? And what do you think needs to be done to positively impact your population? So I'm going to introduce each of them, and then across the board, and then we'll have them each spend 10 minutes sharing their perspectives. And we're going to ask you to hold your questions, but we're going to have a very exciting lightning round question and answer at the end, with buzzer included. So please, if you have questions as they're coming up, jot them down. We hope that that will be kind of a lively discussion after they each have their 10 minutes. So first, we're going to start kind of in the opposite order of what you might expect. Katie Bonamasso is down on our end and is our expert on chronic homelessness, and I'm going to tell you a little bit about her background. Katie has worked in supportive housing and homelessness programs for nearly a decade. She's currently the program manager for the Denver Social Impact Bond Initiative at Colorado Supportive Housing, where she provides day-to-day oversight and leadership to Colorado's first Pay for Success project. She works with community partners on the Denver SIB to target homeless super users of emergency services in Denver with a supportive housing intervention. That project aims to reduce societal costs by increasing housing stability and reducing recidivism. Most recently, Katie worked at the Colorado Division of Housing on the homeless program team, where she provided leadership to state and federally funded voucher programs for homeless, highly vulnerable populations. In this role, Ms. Bonamasso was an active participant in the development of Denver's coordinated assessment and housing placement system, working with the Department of Corrections on reentry initiatives and successfully launching a new continuum of care funded supportive housing program targeting the chronically homeless. And prior to her time at DOH, she conducted substance abuse counseling in an outpatient methadone clinic and worked with Mercy Housing for resident services manager for 10 supportive housing communities across Colorado. She has her Bachelor of Arts Bachelor of Arts degree in sociology and human services and her master's in social work from DU. Welcome. I'm going to keep introducing people if that's okay. And then directly to Katie's right, we have Dr. Stephanie George, who is a clinical associate professor and regional director of field education for the Suzanne Dworak-Peck School of Social Work. Dr. George has been a full-time faculty member with USC since 2013, with teaching experience in evidence-based interventions and clinical social work with military service members and veterans and families. And that's the expertise she's bringing today is around veteran homelessness. Prior to joining USC, Dr. George worked for the Department of Veteran Affairs for 9 years, extensively in the National Homeless Program. Within the Veteran Homeless Program, Dr. George was the National Clinical Coordinator of Education, supporting national efforts in the homeless pilot programs and education for social work case managers in the field. So she can hopefully speak a little to the training piece that's come up quite a bit. Dr. George received her doctorate in education and organizational change and leadership from USC, and her master's in social work from the University of Southern Florida. And then last but not least, we have Livia Davis returning to the stage, and she and I both agreed that I wouldn't go repeat her illustrious bio, but as a reminder that she's the Chief Learning Officer at the Center for Social Innovation. So I'll hand it over to you, Katie. We'll have about 10 minutes. We have a student cat in the audience who will give us a timer when we're really at our 10 minutes so that we can kind of stay on track. Thanks so much.
Awesome. Thanks so much, Kim. I'm really excited to be back at my alma mater, to be here today. I'm a graduate of the Graduate School of Social Work here. And I'm excited to be surrounded by social justice warriors like yourselves, particularly ones who care about homelessness, because I certainly do. And it's something I've spent a lot of time thinking about and working in. So thank you for having me here today. So I work for CSH, the Corporation for Supportive Housing. We are a national nonprofit that specializes in all things supportive housing across the country. We do everything from development and lending to build new supportive housing units to technical assistance and training. We also do some deep dives with communities to help them look at their homeless systems. And I think I'll just start by saying, just simply put, we know the solution to homelessness is housing, right? There's so many factors that play into that, as many people said this morning, but it really is that simple. We need more housing for folks that need them. We also know another thing, that there's a subset of the homeless population who needs more than just housing. This is a population who often is suffering from long histories of homelessness, multiple conditions, behavioral health challenges, all the things that we talked about this morning. And we know that the solution for this population is supportive housing, or programs like Ben said this morning that are operated in a housing first model. But supportive housing, simply put, is affordable housing paired with intensive wraparound services. The services are flexible, they're tenant-centered, they meet tenants where they're at, and they're offered in the community. And evidence shows us, 30 years of evidence shows us that this intervention works. We also know that when there's not enough supportive housing, this very vulnerable population who is experiencing chronic homelessness cycles in and out of incredibly expensive emergency services. So these folks are showing up in our jail systems, our ERs, our detox facilities. These are all systems that are incredibly expensive, largely funded by taxpayer dollars, and have very, very poor outcomes for the homeless population. And so the project that I work on in the city of Denver, the city recognized this. So there's a group of people that the Crime Prevention Control Commission in Denver looked at, 200 frequent users of emergency services in Denver, that was costing the city $7.3 million a year to cycle in and out of these ineffective systems that are really not intended for long-term outcomes. This group accounted for 14,000 days in jail for 250 people, 500 visits to the emergency room, 2,200 visits to detox, 1,500 arrests. And what we found was that these arrests that this group were arrested for were low-level offenses for things related to their homelessness. So public intoxication, public urination, panhandling, all of these things. And we kind of see this across the country, that groups who are experiencing homelessness are actually targeted with laws and policies that put them in our costly emergency services. So you see communities come up with policies like you can't sleep or sit on the sidewalk. So if you're homeless and have no place to sit or sleep, where are you going to end up? You're going to end up in our jail system. And so we don't think this is a really effective way of dealing with a cohort of people that we know really needs our help. And so the city recognized that. And in Denver, we don't have all the resources we need to serve this population. So there's been lots of effort put together to build a pipeline of supportive housing. And our communities are moving towards serving this more and more vulnerable population, but there's this massive gap in funding to do services in an adequate way. And so we use the social impact bond model, or what we call pay for success, because it's actually, in financial terms, not actually a bond. And it's easier to say pay for success project because it's really upfront working capital connected to performance-based contracts. And the way it worked in Denver is we raised $8.6 million in upfront capital to house 250 frequent users of emergency services in Denver. And if we reach target outcomes in the project, which are keeping people housed and reducing the number of days they stay in jail, the city of Denver has committed to pay our investors back with a small rate of return. And this project solved this problem that we're experiencing in Colorado, which is the lack of service funding to adequately provide supportive housing. And so this was the most money ever brought into our state for this measure. So we were really excited about it. And oftentimes you see systems that are disparate, right? So we have all this funding going into the behavioral health system that's actually only connected to community mental health centers, and then you have funds going into the housing system to serve homeless populations, but it's kind of like never the two shall meet. And so it was a great way for us to bring together multiple systems to say, okay, health system, you're seeing these folks. Jail system, criminal justice system, you're seeing these folks. How can we blend resources to more effectively serve folks? And what would I say? So it's a 5-year project. It's one of the most rigorous evaluations that have ever occurred in the United States on supportive housing. It's a 5-year randomized control trial. We partner with the Urban Institute out of Washington, D.C., and also the Burn Center. So thank you guys who are helping us with our qualitative research. And about 3 years in, we spent the first 2 years ramping up. What we found is that this is a population that is very sick. When we were first putting the project together and looking at this cross-system data, everyone said, like, this is a population that's going to show up in our homeless system. They're going to be on our coordinated entry list. And what we found was largely this is a population that we haven't served because they were so sick that police officers couldn't pass by them on the streets without doing something about it. And so they were actually spending more time in our jail system than in our housing and homeless system. And so we're excited that we figured out a way to use data to target a population that has not previously been served. And we've housed all 250 individuals in the project. Also, I think one of the things that is said about people experiencing chronic homelessness is really, does that mean I'm out of time? No. Okay. And you're off. One thing we hear a lot is that these are the folks that they just don't want housing, right? Like they're not able to be housed. They're never going to do it. And again, this is a randomized control trial. We are literally assigned names and we are looking on the streets for people we have never once seen before. They are not looking for housing. And out of 277 people we've talked to in the project, 1 person has refused. So the evidence shows us that when housing and services are available, people will choose housing and services. So let's just dispel that myth now. Yeah. I think the other thing that I would say is that pay for success is super complicated, right? It's this financial transaction. There's this model. You have to create these special entities to oversee the flow of funds from both ways. It took us a long time to get all the partners together at the table. And there's ways to not do it so complicated. So CSH has a model that we call FUSE, Frequent User Systems Engagement. If you go to our website, csh.org/FUSE, you can look at our resources there, but this is another model for looking across systems, determining the costs associated with serving highly vulnerable populations, and then using that data to leverage investment from other sources. So I heard the gentleman is here from a hospital system. We're seeing hospital systems across the country say, hey, actually, it's way cheaper to house and provide services to folks who really need them, to have them in my ER every time they're hungry, need food. And so I think there's other flexible ways to do it, and I think I'll end there, but thank you for having me and letting me share my work with you.
Thank you.
Okay, so the Department of Veteran Affairs in 2010 started the 5-year plan to end homelessness, and so everything I'll talk about is from 2010 to pretty much current day. But from 2010 to 2015, they worked on really looking at veteran homelessness and how to make it zero. Now we have something called, it's almost zero, but what it is, veteran homelessness will never completely be at zero, but what their plan was is to have enough services in place, kind of like Katie was saying, if they're there, if the services are available, they'll use them. So to have every city to have enough services available, so if a veteran wants to utilize it, they're there, the funding's there to support it. So since 2010, there have been 3,000 734 positions for social workers, MSWs, at the VA just in homeless services, specifically in the HUD-VASH program. And the reason why I bring that up is because of training that came up earlier today. The VA trains social workers specifically to work with homelessness, and we partnered with the Beck Institute to do something called CBT-H, which is CBT and homelessness, because what we were finding, our social workers, they weren't working up to their licensure. They weren't doing the work that they were really trained for. They were visiting individuals who were in HUD-VASH, which is Section 8 housing for veterans, and they were just kind of checking the box. And we said, you're licensed clinicians, you can do more than that for the veterans. So we worked with the Burns Institute. Well, we worked with them too, we didn't work with them on this. With the Beck Institute. And actually the Denver VA was the first pilot program we used, and we trained 12 social workers in the HUD-VASH program to do CBT with veterans in housing programs. And what that looked like was on the way to the Social Security office or when they were doing a home visit, they would utilize CBT techniques to get the veteran to have more independence, to gain more independence, and to have those negative automatic thoughts turned to an alternative thought. And so it was something that we really pushed. And if you look at the Beck Institute, the manual, I think is still up there on theirs, but we trained 50 VAs across the country to have social workers do CBT-H. So that was one thing the National Center on Homelessness within the VA program was really proud of, because we want social workers to do more than, say, case management. It's not enough. We want MSWs to know case management can be clinical. So really important. My job at USC is I place students in field all across the country in our virtual program, and time again I hear that social workers don't want to work in homelessness because it's just case management. Case management is the foundation of social work and is so important because that's what actually makes movement and action for our clients. So the VA really tries to promote that case management, again, is clinical. So I wanted to go over some of the programs. So since 2010, a lot of these programs have existed in the VA, but since 2010, they've had an enormous push. HUD-VASH, as I mentioned, is the housing program, so Section 8 housing specifically for veterans. They have housed over 85,000 veterans since 2008. There's 85,000 vouchers across the country, Denver being one of the leading cities as well for housing vouchers. SSVF is another program, Supportive Services for Veteran and Families. There's so many numbers to go over, I had to write them down. Since 2012, they do rapid rehousing, and they also do prevention as well. So they try to get someone before they get kicked out of their housing, as long as it's not a mortgage, as long as it's a rental. They try to help with rental if they're behind on their rent and rental arrears and those things to stop them from becoming homeless. If they do become homeless, then they will rapidly rehouse them. Since 2015, they have helped 157,000 veterans across the country, and 99,000 of those are specifically veterans, and 34,000 are children. SSVF is one of the only programs in the country that works with children with veterans, because the way the funding works in the VA is the funding's attached to the veteran. So in HUD-VASH, if they happen to have children, they can live with them, but if anything happens to that veteran, the family loses their housing, unfortunately, because the money follows the veteran. With SSVF, it's a little bit different because it can follow the children as well. If something happens to the veteran, then the family can still stay in that housing for 6 months, which was the original plan, so then they can find alternative means. Since 2015 as well, only 9.4% of the 157,000 returned to homelessness after 1 year, and 15.5% returned to homelessness after 2 years, in just specifically that SSVF program. SSVF right now, I believe, has an operating budget still of about $300 million a year, and they started at $600 million a year. So since the 5-year plan started, that was always our question. Was what happens after 5 years? Do they just stop giving us money? And this year, actually, the VA, they did that in a sense, where they said, when the new secretary came in, who's not there any longer, said, I don't even know who the secretary is right now, but he decided, let's just use general purpose funds and take all the money that used to go specifically to the homeless program and put it as general funds. Veterans advocated and said, absolutely not. This money needs to be for homeless veterans, and they put it back into special funding specifically for the homeless programs. So it goes to show that advocacy really does work, especially when it comes to veterans and comes to finances and where that money should be. Along in the homeless program, there's also, here in Denver, Denver's actually, as I mentioned, one of the biggest pilot sites for the National VA Office of Homelessness. It's 1 minute. Denver, Seattle, Los Angeles, of course, and Tampa, Florida are typically the pilot areas that we do a lot of the pilot programs across the VA homeless program. And Denver has something called, this is the last thing I'll talk about, a one-stop shop for veterans, and they're actually changing the location right now, I believe, off of Federal. It used to be off of Downing. But what it is, it's an office where veterans can come in and get multiple services. They can get health care, they can get food stamps, they can get groceries, they can see their comp and pen individual. And the hopes is if they go to comp and pen, that's where they get rated to determine their percentage of service connection, disability, those things. If they could get in that office, get their disability rating, then get funding, they then can get housing. So this one location has all of those things in one building that's not in the VA, because they're finding, of course, a lot of people don't want to go to the VA sometimes. So they're doing alternative placements around the city for veterans to have better access to all of these things and not to have to go across the city on a bus system or walking or when it's snowing. Everything's there at once. And so Denver actually has one of the most successful programs for that one-stop shop. So I could go on for like 2 more hours, but I'll stop.
All right, hi again. So as Dr. Henwood said earlier, homelessness has increased, and the same is true for family homelessness. 3 decades ago, families were rarely seen on the street, and now they make up 36% of the homeless population. We also know that family stays in shelters has increased dramatically, which means when you have half of the children under 6 living in homeless shelters, that a good portion of their early years are spent in shelter environments. And so I just want to point that out as I get into just talk a little bit about, what policies, what are the kind of current state of national policies as they impact family homelessness, because I'm going to talk about family homelessness. What's working to impact family homelessness positively, and what are some things that I would love to see. So I took that as the homework, so I'll try to see if I can't do that. So. I think some of the national policies that are impacting family homelessness, HUD has a policy really around, how do you count homeless, and how do you really look at figuring out what is the extent of homelessness. We know that the HUD policies do not effectively address the needs of homeless families with regards to what they need for services. So that's just one very kind of specific incident of a national policy, and in a way that probably is not surprising, given that it's the Department of Housing and Urban Development. How much could they possibly know about services, right? And so you have a department that has gotten into homelessness and services and what works. And I would love to see some more collaboration with Health and Human Services, but that's where a lot of the funding is. And we know how it goes into the continuum of cares. We know how we get models from the bottom up to kind of influence policy. But that's an issue. HUD doesn't understand necessarily what's needed for family homelessness to end. The definition of homelessness, it is trying to change so that families can be better accounted for, but that also right now is not necessarily working to count homeless families, because the definition, really doesn't encompass a lot of the dynamics with family homelessness. And then the other thing we have for some national policies is that the existing poverty reduction programs that address the necessary services, they're not adequately funded. They're really underfunded. So those are just kind of 3 kind of national policies that I wanted to mention that impacts family homelessness. So what policies are working, or what practices are working? So we do know some things that work with regards to services for homeless families. And one of the things that we were trying to really look at promoting is actually home visiting. So home visiting is in place, has lots of research behind it, and it is something that you can access if we can figure out how to get home visiting to parents, to families with small children, homeless shelters. We have a model that we know works, that has great outcomes for those early years, both for parenting and for making sure how do you work as a family, how do you function well, how do you support your kids. So you have home visiting as a model, and if we could figure out how to get that into shelters more where the homeless families are, we really have something that we could pursue. So I would love to learn more about that and figure out how we can do that. Another thing that we know from homeless families is that so many of them are dealing with major depression and trauma. So a lot of the households that are experiencing family homelessness, the moms have about 45 to 85% higher major depressive disorders than the general population. So that talks about the need for training of the workforce that works with homeless families, right? But it also really looks at what works to really address major depressive disorders or mental health issues. And we do have some that do. And we know one of the reasons why major depressive disorders happen is because of trauma. And so trauma-informed care, there is a lot of work that's happening around trauma-informed care. A lot of, how do you change your policies? How do you change your environment? But there's also some models that now are very skills-based, where you can go in and get trained so that you know specifically what to do when you're dealing with or handling or working with moms or families that have a lot of PTSD, a lot of trauma. So we know interventions that work. And the other thing that I wanted to just mention with regards to what I would hope would happen, kind of what I think would be really good, is that we know that from the adverse childhood experiences among homeless children's rights, so the ACEs, there's a lot of research behind ACEs. And so that we know that if ACEs, adverse childhood experiences, are left unaddressed, it predicts poor medical and mental health outcomes both in adolescents and adults. So if we can take that research and say, how do we pair that with some of those service models so that we know work, then we can do a lot to address the needs of homeless families. Because homeless families, because the mom is often in need a lot of supports, that impacts the child. And the child also, of course, have developmental needs. If we can figure out how to address that, we can make a huge difference, especially if you think about the lengthened stays in emergency shelters. On the face of it, it's not a good thing because you want people in housing. But if they're there, is there a way to take that as an opportunity and turn it into a really good response by adding not only the clinical piece, but also the housing piece, and then this second thing that I'll talk about, which is the relationship piece. So if I had my way, we would learn a lot from a researcher in the UK called Hilary Cottam. Hilary Cottam had a TED Talk called Our Social Services Are Broken and How to Fix Them. And what she did was she went back and said, okay, I'm looking at all these human services and I want to understand the history of them. And so she learned that in the 1940s there was a person named William Beveridge who designed, really is the architect of our welfare model now, and we all kind of living with that history still, so it's important to understand our history. And what he and his contemporaries thought was that, if you want to help other people, he didn't trust the normal emotional man or woman to know what to do, so they created a system that designed the relationship between people out of...
Amber alert. Mine's doing it too.
Oh.
Yeah, so everyone's phones are going to go off.
We'll wait. That's important. That's okay. So basically, we are still living with an architecture of our welfare models that says, don't have a relationship with people, don't share your vulnerabilities, you're the expert, you know better, and that started to get upended, and if we can put that piece back in, then we're going to have a lot better outcomes, because it's not only about providing clinical services. It's about helping a person create health, purpose, community, and also, wellness, right? I mean, it's really about the whole person. And so if we can get that back into our services, that's what I would want. So Hilary Cottam I urge you to see her TED Talk. It's about 20 minutes. You'll learn a lot. I think I have watched it probably 15 times, and every time I learn something new because I think she's just really that good. So I have a lot more, but I want to say that we do know some of the interventions that work. You want to combine that with the housing, and you want to put the relationship back in there, because the other thing that research shows is that when you are experiencing homelessness, many of the homeless moms, and because 90% of homeless households are headed by women, it's not that they themselves are the only ones that don't have any resources to get out of crisis, right? And so if I'm in a crisis, I have a network that I can count on, that I can reach out to for help with rent or mortgage or transportation. Homeless families support networks also do not have any resources to give, or very limited. So you now have a double whammy in that you don't have a network that you can count on to help overcome some of the crisis. So we need to look at relationship capital in all our systems, and we need to look at what does the support networks look like for homeless families to help them overcome homelessness. So I'll end there.
Thank you, panel members. You kept to your time and shared such wonderful ideas, and I'm sure our audience is going to be excited to engage them. So this is the lightning round, you all. This means that we get to kind of raise the energy in the room, raise our hands, ask questions of one or more of our panelists, and what makes it lightning, I'm told by Danny, is that you only have 2 minutes to respond to those questions. So, Kat Huey, will you raise your hand? Kat is a master's student and working with our Burn Center and has been instrumental in helping to prepare for today and will be our timekeeper. And I believe we have an option for our online guests to also ask questions. So if there are those, raise your hand and we'll make sure that we get their questions in too. So we have, I think, until about noon to engage our panelists. Remember that we have expertise here both in chronic homelessness, in veteran homelessness, and in family homelessness. But really, it's a free-for-all. Any question that you have burning, raise your hand, and we will have someone come on out and give you the mic.
Oh.
Yeah. Nope, go ahead.
Okay. My name is Gary, and I'm with the Burn Center. My question is, what's your response to providers who say housing first is an unfunded mandate?
That's a hard one because that's actually what I was speaking to, is that really we don't, in Colorado at least, have adequate funding to deliver services. But what I would say to that is that if you're not doing housing first, you're not going to get the desired outcomes. So any money you're spending to do Housing First Light or supportive housing light is not going to be effective and ultimately a waste of money. So do it right or don't do it at all.
And I can say for the Department of Veteran Affairs, they've actually said it's policy that they use Housing First. And so for the VA, it is funded and supported.
I'm concerned as to veterans. You said that as long as it's not a mortgage. Many veterans have homes.
Yep.
Why not? Policy?
Yes, yeah, Congress is the answer. That's why, because the way the policies and bills are written are only about rental assistance, not mortgages. There are some mortgage programs that help, but what happened, when I used to be a case manager for the VA, we'd have, especially during the crisis 2006 through, I feel like still sometimes, but people were losing their homes so rapidly, and we'd have veterans come to us and say, I know I'm going to be homeless in the next 30 days. We could not help them until they were out of a mortgage for 30 days. With the funding specifically under the homeless program, and it was so frustrating. And there was no answer financially that we could do, so we would try to use community resources and say, use these community resources. Once that's exhausted, then come to the VA and we could help you. But it's all the way the bills and laws are written, so we really have to pay attention to what those are, and again, advocate to change them, because what Congress and Senate put in place is very, very difficult to change, and you can't go around it in the system, unfortunately.
My name is Colin, and I work at the Burn Center as well. My question is, how much do we know about external but related market conditions like vacancy rate or average median rent, and how that kind of impacts or changes how services are provided or the effectiveness of interventions?
So I could say nationally that's something the VA looked at often because, as Ben mentioned, or a few people have mentioned, but a lot of the housing choice voucher programs, you could be anywhere as long as that landlord will accept a Section 8 voucher. That did change with markets like Denver, like Los Angeles. So many places where, who was it that said 3,000 people are moving to Denver, was it every day? With that happening, the problem is that even with people having choice, we're finding landlords don't want to take the Section 8 vouchers because they can get more money from somebody else. So it's a huge problem. And also I can show you this later, but Zillow put out a report of the increase of Zillow rent increases by state, and they have a projection as well. In Colorado is going up 6%, Washington State 11%, Oregon 13%. So pretty much the whole West is just skyrocketing for the rents. So I have no answer of how to fix it, but.
And I would just add to that, in Denver, I think what you see happening is as rents increase, people with subsidies are being pushed to outlying areas in the community. And so they're further away from service centers and transportation and other resources just to gain access to more affordable units. And again, as the rents push up more and more, landlords willing to take Section 8 likely don't have the best units. And so sometimes we're stuck between a rock and a hard place, putting our clients in places that we would prefer not to just because it's what's available. And so building the supply of new housing is critically important to this whole conversation.
Hi, my name is Brian Arnold. I understand that it takes a community, or I believe it takes a community to solve homelessness. And so I have about 500 volunteers that I'm trying to utilize. And I'm wondering how you guys do it with training and, my goals with the social workers that are building to alleviate a lot of their casework management, that kind of stuff. But what are you guys doing? Because I'm realizing that for wealth transfer to take place, people have to be involved in the solution. And so how are you growing volunteers? How are you utilizing volunteers? And how are you training volunteers?
So at the Center for Social Innovation, we are not direct program providers at this point. We do a lot of work to train workforce people in different systems at the program level, at the community level. So I can't tell you how I'm training volunteers because I don't have any, but what I can tell you is that when I was a person who ran programs, I did have volunteers, and it is hard to have volunteers become involved in being part of the solution with regards to developing community with the people they're serving if there is no interdependence. And so what we found is that if a volunteer comes and they're serving meals or they're doing transportation or doing whatever, and then they're going back to their homes afterward, then that is a really good thing, but it does not connect interdependence. And we really believe that interdependence is part of what will transform how we work and how we become a community. So if you are dependent on each other, that means that maybe there's a way for the program to help the volunteer as well as the volunteer to help the program. And that's really, I think, where we need to focus our attention in order to really make a meaningful change in how we interact with each other in any community. I had 1 minute left, so I had to stop, sorry.
It's lightning. So can I just ask you, are there
places where that's been modeled and it's successful?
For our communities.
For the interdependence component you're talking about, like in Great Britain, where they're doing that.
Yeah. So I know that there are a few places. I mean, the one that I'm most familiar with, of course, is the farm in Denmark where I grew up, right? And so the beauty about that model is that the place will not survive without everyone contributing. So the newest person coming in the door is working, and the person who has been there for 20 years is working, and all is working towards the same goal, which is to make sure that the farm community will survive. And that looks different for each person, but every person contributes. And so sometimes when you have something that is mutually beneficial, that you're all kind of working towards, that creates interdependence right there. So for example, if I need a ride to the grocery store, but I don't have a car, then rather than going out and trying to figure out the transportation, maybe I exchange that, for another service that someone else can give me. I mean, so I'm from Denmark. I'll give you one concrete example of how this translated for me in my life. I moved into this new neighborhood with my husband, and I said, hey, we got neighbors in this cul-de-sac. This is great, and they got lawnmowers over there. Do you think we can talk to them about, sharing lawnmowers and buying one together so we don't all have to have 3 in the cul-de-sac? And my husband said, what? And I said, well, that I can go to the grocery store and and it was such a foreign concept that there was no way that that was going to happen unless I kind of forced the issue. Kind of went to my neighbor and said, okay, I'll talk to the wife, because my husband won't talk to them. So I basically said, hey, would you want to, change? I'll go to the, so that concept you can do with volunteers and programs too. And there are places that do it. In this country, I don't know how many of them do, but we do have them in England, and we have Belgium and Denmark.
Okay. I have a question, wondered to know if you have any examples nationwide of school districts that have worked effectively with homeless institutions and advocates to house their homeless families and get them out of shelters. Any examples?
I am sure there are some examples. The Schoolhouse Connection is part of the National Network to End Family Homelessness under the Basic Center. And I can ask them if they know them, because they do a lot of work to make sure that children in the schools are working closely together. But I personally do not know about any school that is involved in making sure that the kids are housed.
I'm asking beyond the McKinney-Vento Act, which schools are required
Yep.
by federal law
Yep.
to work on homeless issues, but they don't work on housing homeless families.
Right. No, I don't know of any personally.
That's nothing's coming to mind. Or maybe Scott does.
There is funding currently available from Katie's old employer, the Division of Housing for its in-base rental assistance that funds very limited voucher programs for homeless students experiencing homelessness and their families through various school districts across the state. But it is limited. Sorry, not on the agenda, so talk about that.
We have a question from somebody who's watching online, Jessica Kohlauer, and she was like, how do we get more affordable PHSH housing built? How do we get developers in on this besides the low income tax credit?
It might be you.
So I think partnership is key, and blending resources. So the development of affordable housing is always like what we refer to as this layer cake, where you take a little chunk from here and a little chunk from here. And so exploring I know in Colorado, they've launched an effort called the Supportive Housing Toolkit, in which they bring teams together around particular projects. So it's almost like arranged marriages, developers, service providers, funding entities, and they go through this intensive 6 months training process to learn how to develop supportive housing. And then on the back end, our state finance authority, which I know is tax credits, you asked how to do it outside of tax credits, that's difficult, pairs funding with the Division of Housing. And so those resources are set up to be paired on the back end, which in Colorado has been critical in developing close to 600 units of supportive housing across the state. outside of tax credits, that's hard. I think we're also seeing across the country models like flexible housing subsidy pools, where private investors and philanthropic entities all put resources in one pool to solve a need in a community. For example, in Seattle, they're using those resources to voucher people in place as they wait for Section 8 for their name on Section 8 to come up. In some communities, they use it as just scattered site voucher resources. In Colorado, I would love to develop a pool that could be used for flexible housing subsidies and service dollars at the same time. So there's ways to convert existing units into supportive housing by using flexible resources to offer the subsidies.
Actually, just for the online, if you'll use the mic. Thank you.
I think you brought this up earlier, but how do we dispel the myths? I mean, before we can talk about housing, you know, I look at the Lakewood program and I don't know what's going to happen with that, but it seems like it's being shut down. Yes, we can continually house people in the city, and I know the beloved community fought very hard for the tiny homes to be and access there, but how do we begin to bring people out of urban neighborhoods and into more community and suburban areas and dispel those myths about mental health and homelessness in general? Has anyone seen that work being done? Is it funded? How can we do that in suburban areas?
I think allowing folks who've experienced homelessness and who are placed in housing or both at the same time to share their stories is critically important, because once you meet people and know them and know their experience and have a face to put with a name, it's not so scary to think of that person living next door. You know, us as advocates sharing stories, but also encouraging people with experience to say this is what happened to me and this is how it benefited my life. I know in LA they have a great program, it's called Speak Up, where they convene advocates with experience from everywhere to be at every hearing, at every you know, opportunity for political change at openings. And so making sure we integrate the voices of people with lived experience into the conversation is key, I think.
Yeah, and there are a lot of social media campaigns that are running. There was a really successful one in Orlando where they just I Have a Name project, and another one they started in Orlando where they're really just saying to people, these are human. Someone said earlier today, these are humans. It's not a homeless person. We have to learn the right language, right? It's a person experiencing homelessness. They're still a person. They stand alone in that. And so they've seen a lot of success of just understanding and better use of language through a lot of social media campaigns, specifically Instagram or Facebook as well.
There's a Close to Home is a model here in Denver in which they're doing that similar campaign. So they've used funds to train people with lived experience to become professional storytellers about their experience. And you can actually, when you go to their website, see the storytellers and even invite them to your own events or to your own announcements so that they can share their experience in a way that has impact in different spaces.
And I think I would add that, so I tried to start a farm community for the homeless in the U.S. based on the model in Denmark, and was faced with a wall of NIMBYism that took 10 years, and we were not able to do it in the end. But I learned a lot of lessons from that and what not to do. And one of the things you should not do is get up in front of 200 neighbors without having people there who have experience in homelessness so they can put, a face to the stereotype that they have. Now, that may be a lot to ask somebody with lived experience, but most of them are really happy to do it. I'm not saying somebody maybe currently in the experience of homeless, but who's been there, because there's no easier way to try to dispel those myths than having those opportunities where you can connect with someone. So if there are opportunities to do that, that's the surest way that we know of. And so that's why when we do trainings, we always do it with our colleagues who have lived experience.
And One thing that I just thought of too is starting the conversation early. I feel like we find ourselves as housing people in these venues where suddenly there's 200 people in the room who are opposing a project. And we had been thinking about it all along, but then suddenly we're there. And, you know, had there been smaller opportunities or, you know, people in droves out shaking people's hands, knocking on doors to say this is what we want to do, starting early also can be helpful.
So I'm Stephanie. I'm a social work case manager at Lutheran Hospital here in Wheat Ridge, and I'm here with a couple colleagues. Katie, you talked a little bit about emergency room visits and how hospitals are often a first and really bad point of contact for homeless individuals. We'd really like to do a better than terrible job, you know, as hospitals and medical providers. What are some of the more successful interventions that hospitals and emergency rooms can adopt to help direct homeless individuals into supportive services and kind of that housing pipeline?
That's a great question. They can invest directly in housing. No, I'm kidding. That's what we all want. But really, honestly, yeah, that's honestly what really successful hospitals across the country. There's a new project that just launched in New York where the hospital is paying for all housing, all services. So that's like the golden standard. I think when you're not ready to do that yet, we need like navigation services from the hospital, from experienced social workers who know the system and aren't giving people, when they leave the emergency room, a list of contacts that hasn't been updated in 3 years. And that person needs to be a liaison to the broader community. We've seen these kind of positions in the past where like they're just in the hospital, but get them out in the community, meet the people in the homeless system, connect with other resources, and so really making sure that the people are followed as they're exiting the hospital is critical.
And I can say the VA model, it is a 13.3% higher rate for people who are experiencing homelessness than individuals who are not homeless for emergency room visits at the VA. They do something called HPACT, which is Homeless Patient Aligned Care Team, where they actually go out in the community to the individuals experiencing homelessness, to the camps, and do the care physically there, where they don't have to come into the hospital. And that's been a very successful program run by Dr. Tom O'Toole, and he's actually just submitted research or a publication within the past year talking about all the figures of financially how it's really just changed the ERs across the country in the VA. And the one-stop shop that I talked about in Denver, it's called a CRRC, they actually have an HPAC there as well. So there's an alternative to the ER for the homeless veterans in this area.
And the one thing I just thought of too as we were talking, there's an intensive outpatient clinic at Denver Health that has very reduced caseloads and social work and behavioral health staff on site. So they actually did some frequent user analysis of their own and realized, wow, this group is really costly. How can we provide them better care with better outcomes? And they realized that it was more intensive outpatient care and services that connected to the community. So I also think that's a successful model as well.
I'm Elaine Gallagher, 50 years volunteer with homelessness. My question is, what is the role of tiny homes? How does that fit within the solution?
No, you can get out.
That's a hard question and something that comes up a lot. I think that tiny homes are a tool in our toolbox. Like, we need more housing inventory, bottom line. Any housing inventory is great, and if a tiny home is what a person experiencing homelessness chooses, that can be a tool in the toolbox.
So I first have an answer to the Lutheran folks. There is a group here in Colorado that's been working on social determinants of health issues around the state, and I'd like to connect you with that group because it has public health folks on it. It also has Children's Hospital and Denver Health and a number of clinical folks also engaged. And we're trying to figure out how do we develop kind of databases, resources that can be used statewide obviously Children's is trying to look at a 7-state region, and so we're trying to look a little bit more broadly at how do we put those resources all in one place that gives us access and also gives us the opportunity to do evaluation on the gaps to those resources in different places. But I do actually have a question. Sorry, you're welcome. I'll get you a card and we can connect on that. You said something about doing home visits, and we have a home visit program that we do. I work in pulmonology medicine, and so what we're doing is looking at homes for asthma and asthma triggers. And I'm wondering if we went into a shelter with that kind of a program as a home visit and said, look, you've got kids here who have asthma, you have adults here who have asthma, we're interested in doing sort of spirometry or treatment, but we also want to look at your environment and see if we can help you improve your environment so those kids and those adults' asthma isn't being triggered by the environment. What do you think about that kind of an idea? I think it's maybe a little bit more complicated than I'm making it seem, but I'm going to go back to my doctors and try to figure out, is this something we can do? But I would like to get your thoughts on it.
Well, we know home visiting works. It absolutely works. It absolutely works. The research works. The outcomes of it are great. So I would love to talk more about how do you take that model and apply it to shelter settings. And, whether it's a specific, challenge or how you, or a symptom or a sickness that you're addressing, or, if all of it, the model works. So any discussion, I would just love to talk to you more about it, because I think it's a huge opportunity to take a model and say, how do we adapt it to best meet the needs of homeless children and homeless, households. So I don't have much more to say other than that, other than, yes, let's talk. It should work. Yeah. And depends on the shelter setting too. Some have, congregate sites, some of them are out in, scattered sites. So it also depends, what can we do with the environment? I'm sure there's lots we could do with the environment. Yeah. Thank you. I also wanted to just say one thing about the emergency departments. Recovery coaches are now being utilized more and more in emergency departments to really help combat the opioid overdose crisis. And what that means is that if somebody's overdosing as soon as they've been administered, an naloxone or something similar, they are offered the opportunity to talk to a recovery coach. And that's someone who's been there. It's somebody who may have been abused heroin or been a substance use disorder person. And what they're doing is really saying, hey, if you would like to come and be part of a recovery community organization, or if you want to know about some supports, I'm here. This is not a clinical role. It's a non-clinical recovery supports role, and it's someone who's using their story to connect and say, there is hope, and if you're interested, I'm here. They are doing it more and more in emergency rooms because they understand, how much that works. And there might be something to learn from that model as it relates to homelessness. So it's almost like a peer role for homelessness that you could look at maybe adding to emergency room settings.
So we use a model in the Colorado Coalition for the Homeless of a Renaissance housing, which we've done since we did Civic Center apartments at the YMCA and sold back the Y to them and then built it. John Parvinsky's been in charge of that. We also have an integrated health model where we put housing on top of the health care of Stout Street Health Center. If nobody's seen it, it's a pretty remarkable program. Mixed use development is one of the ways we break down those barriers. Could you speak to how we can use more models that show how we're not like with horns and a tail?
Housing, I think it's
I don't know, to be honest. I think, from my perspective, I'm not going to answer your question with a good answer. I think for me, from my perspective, is education. We have to educate, and kind of back to your point in the middle of just the myth around homelessness and then speaking, with horns and all of those things. We have to educate people on the complexity of homelessness. And one thing that research says, social workers in particular, We forget sometimes that poverty is the underlying problem so many times, and we don't have a poverty approach to the work that we do. And we say, oh, all my clients are living in poverty. All of my clients are under this certain threshold. So we normalize it and we ignore it. And so I think that's a huge important piece, especially for social workers, is that we don't forget that piece of really understanding the complexity and level and starting with poverty in general. So I know that did not answer your question, but I think the big part is just education. We have to educate each other and then hopefully have an answer to your question from there.
So we've been engaging in some interesting hackathon events here at the school, which does not solve a housing model, but brings people together from all different backgrounds and experiences. So I've been focused on young people, but young people who are experiencing homelessness, meeting with social work students and engineering students and computer science students and people from the community who come and learn about the issue from people who have experienced it, and then quickly start working together to design solutions. And that goes back to your piece around interdependence. If we can all come to the table to think together about how to solve problems, it's not just that I want to learn about it, but I'm now invested in thinking about how to change it. So those are short, intensive events. They're not a cure-all for everything, but what it's doing is bringing people to the table who then leave, and we got kind of caught after our last one with people saying, now what? Like how can I volunteer? What's your listserv? How do I do more? How do I advocate? So I do think there's populations of people out there who don't know much about this issue, but when brought to the right table and engaged in a meaningful way, will get on board.
And I also think that examples are in some of the things that you mentioned. So CCH did just develop their building downtown. It's 100 units, and the community prior to its development said, this is going to terrify market rate investors. No one's going to want to build by here. And you can stand in the huge floor to ceiling windows of the new building and look across the street. There is 1,000 unit for-profit development right across the street. And so sharing examples like that to say, you know, we don't have horns and tails, and we're going to be in the same neighborhood anyways, because once you develop it, people don't care.
And this will be our last.
Right.
That is where you're going to get rid of those tails and those hurdles.
So we have time for one more question. Scott, did you want to ask yours?
I actually had 6 questions, but or maybe 6 comments. I'm Scott Shields. I guess I'll direct this mostly to you, Katie, just from a local perspective. You alluded to how some of the Pay for Success and social impact bond initiatives are starting to get some traction with other financing models, such as hospitals, which is great to hear. But can you speak to any other communities across Colorado that are looking at Pay for Success and social impact bond type of projects that have not what I guess we affectionately call debruced from the Taxpayer Bill of Rights, and whether or not there's any evidence that these programs can actually be done in communities where they have not debruced, which means essentially sort of Well, I won't go into that.
That's a longer explanation.
Absolutely.
So we are working with a number of communities across the country, about 40, to explore these frequent user pay-for-success projects. Currently, there's no other pay-for-success initiatives in Colorado specifically. We have had brief conversations with Colorado Springs, who's interested in the model, but again, I feel like a lot of people are waiting to see how we do. You know, we didn't have data for a while, but we did release our first outcomes in October, and we'll be releasing another set this October. And so hopefully we can push that as we have more data to share about what's actually happening.
Great, thank you all. Can we give our panelists and our moderator a round of applause? Thank you all as well for your thoughtful engagement. We hope that continues after lunch, which is now. There are box lunches behind you. Please get up as you will. We have about a half hour or so break where you can get your lunch, and then we have a fantastic lunchtime program by the founder of the Burns Center, Dr. Don Burns, and Jamie Reif. So please get up, stretch, take a walk outside, get some lunch, make yourself comfortable, and about 12:30 or so, we'll reconvene for that program. Thank you.
And I couldn't see her for a few minutes, and I was like,
Thank you.
Thank you.
Thank you. You all are great.
Thank you.
Thank you so much. Great work sitting there.